Legacy presents The Ripple Effect.
The following is an interview with the researchers of Latino College Health Initiative, a report produced in collaboration with Legacy and the Hispanic Association of Colleges and Universities.
The Latino community is one that is the fastest growing minority community in the country. It is already 16% of the country. By 2035, 1 in 4 in this country may be Latino.
You rarely see studies breaking out different subcategories of Hispanic. It should be done. There's different cultural heritage. Those cultural issues are going to affect attitudes and they're going to affect behavior.
This research actually starts giving the nation an understanding that Latinos are not one, that they are multiple Latino groups, and that their patterns of use of tobacco products is very different.
Our overall sample was Hispanic college students, and the subgroups that we were able to break it into were Mexican American, Puerto Rican, Cuban American, and Dominican American.
It is important to work with Hispanic colleges and universities because their student bodies are supposed to be at least 25% Latino. And if this is a population that goes to a lot of community colleges, is lower socioeconomic level, they will be the target of the tobacco industry.
Considering that 99% of smokers began by the age of 26, looking at college students is critical to getting informed in terms of their tobacco use so that we are better prepared to really address this issue.
Hispanics are a young group, and in fact the majority of the Hispanic population is within the 18 to 26 age group that were targeted in this study.
One of the key findings that came out from this report is that there are differences between the subgroup populations in terms of prevalence, in terms of usage, in terms of what products they are using.
The Cubans and Puerto Ricans have the highest prevalence of cigarette smoking, and the Dominicans from the Dominican Republic have the lowest.
This report indicates that smoking is higher on students that live on campus than those that live away from campus.
There seems to be a lot of poly-tobacco use, kids who are using multiple tobacco products. Obviously, cigarettes is the main one, but it seems like they are also using or experimenting with, for example, electronic cigarettes. They're also experimenting with hookahs.
The use of hookah is one of those things that's just, it's blowing up. It's massively on the rise.
We have the evidence to show that one size does not fit all when it comes to Hispanic Latinos. The data indicating significant subgroup differences needs to be incorporated in any kind of public health campaign and health intervention programs that are targeted to Hispanic Latino groups.
There was a lot of smoking among on-campus students. So something that probably many colleges can do is go tobacco-free campuses. That will be a good intervention, especially if there is some enforcement in terms of those rules.
Colleges and universities need to create alliances with communities in order to start restricting the number of hookah bars. And do that because where there is a proliferation of hookah bars, that is where we see more smokers using multiple smoking products.
Visit legacyforhealth.org to learn more.